Closing the gap in cancer care is a very important step to be taken in order to reduce the burden of cancer in the world. However, the inequalities in the care for cancer greatly affects the effort in reducing the cancer burden. Lois Abasambo brings this report on what stakeholders are doing to close the cancer care gap. Her report.
With a clear distinction in cancer care and treatment between high-income and low-income countries, a World Health Organization survey reveals that cancer patients in low-income countries have a lower chance of survival than patients in high-income countries. In order to bridge the cancer care gap, the Department of Radiotherapy and Oncology of the National Hospital Abuja organized a town hall meeting with all relevant stakeholders and cancer patients to discuss the way forward in the treatment of cancer in the country and how to close the care gap.
We do recognize the fact that there are a lot of gaps. And for us to be able to fix this gap, a lot of things must be put in place. The councils must rise to the occasion and be able to go to hospitals and demand answers.
Cancer patients and caregivers decried a lack of regulation of cancer diagnosis, treatment and care, which has caused great damage as patients have been wrongly diagnosed, leading to complications.
The first histology that was done somewhere in Ilorin was a wrong report. The second histology that was done while she was opened up came out 4 months after her death. So these misdiagnosis and our diagnostic centers, not just advising them or ensuring that people are properly trained, we should also have monitoring. It's very, very important.
Head of Radiotherapy and Oncology Department, National Hospital Abuja, Dr. Uchechukwu Shagaya, says the hospital, in its effort to bridge the cancer care gap, has digitized its services in order to make hospital appointments easy and seamless for patients.
We've released 4 hotlines that will be used by patients to reach their caregivers. They are very easy to remember. We have 0916 4444 241. That is for the Oncology Secretariat. You want a medical report, you need any of those, anything admin related.
A cancer diagnosis has the potential to push families into poverty, particularly in low-income countries. This calls for the need to include cancer care in the National Health Insurance Scheme. The Executive Secretary and Chief Executive Officer of the National Health Insurance Scheme, Professor Nasir Sambo, represented by pharmacist Gali Mood, said the NHIS, in its bid to close the gap, has also included partial treatment of cancer into the scheme, which helps subsidize the treatment of cancer for patients.
The scheme included that some sessions should be conducted or should be covered by the scheme. And also, we added a lot of other drugs that are meant for the treatment of cancer.
Earlier in his speech, the Chief Medical Director of the National Hospital Abuja, Dr. Jaf Momo, called on stakeholders and partners to help in financing to close the cancer care gap in the country. The need to scale up cancer care in low and middle-income countries is urgent as the World Health Organization projects that cancer death rates in Africa will rise exponentially over the next 20 years unless resources are placed within health services to appropriately treat and manage the growing cancer cases. Lois Abasambo, ASO Television News.